to start with you, Dr. Karsh. Would you define what bladder cancer is?
Well, bladder cancer is a cancer that grows in the bladder, and we know that 83,000 people in the United States will be diagnosed this year with bladder cancer. It's the sixth most common cancer and the fourth most common in men, and usually occurs in people that are over age 55. And at the time of diagnosis, about 75% will have something called NMIBC, or non-muscle invasive bladder cancer. And this is a cancer that grows in the lining of the bladder, so that it's detected earlier before it gets into the muscle of the bladder or has gone through the bladder.
What kind of symptoms, or what should one be looking for?
So the typical symptom or sign is going to be blood in the urine. And it can be anything from a dark cherry red color, a burgundy color, a rosé color, even a cola color. So that is really the hallmark sign that you have is blood in the urine. But sometimes it can be associated with burning in the urine, or painful urination, or urgency and frequency of urination.
Just to be clear, does it change the color of the urine?
Yes, and so it can change the color, so you might see blood in different shades of blood in the urine.
What has traditionally been... I'm sorry, go ahead.
No, I was going to say that you can have these different colors, cherry red, all the way to a rusty color, cola color looking urine.
Yeah, I understand you have a lot of expert information on NMIBC, and what is that? And tell us about the treatment for it.
So the standard of care treatment for NMIBC has been BCG treatment, which is a type of immune therapy that's given directly into the bladder through a catheter. Some chemotherapies have been used, but the BCG is really the more standard one. But not all patients will respond, especially if their tumor comes back, so that we know that about half the patients will have a recurrence of their non-muscle invasive bladder cancer within a year of treatment. And so I'm here on behalf of Ferring Pharmaceuticals to talk about a newer type of a gene therapy. And this is a therapy called Adstiladrin, and it's for patients who are no longer responding to BCG, and they have a high-risk non-muscle invasive bladder cancer. And this therapy is the first and only gene therapy approved by the FDA for non-muscle invasive bladder cancer. And it can have some side effects, which include urethral discharge or bladder discharge. You can have urgency and frequency, as well as some blood in the urine and fatigue. And so if you have non-muscle invasive bladder cancer that's not responded to BCG, ask your physician whether or not this treatment is right for you.
I want my audience to know that Dr. Karsh is a urologist, and he is the attending urologist and director of research at the Urology Center of Colorado. Correct, Doctor?
Yes, and we're now called Advent Health Urology.
Okay. I'm going to switch to Mike. Mike, thank you for waiting. I'd like to know, tell us a little bit about your diagnosis of high-risk NMIBC, and how are you doing today?
Well, it was about 8 years ago, and I was using the restroom at my office, and I noticed blood in my urine. This was shocking. I had never seen that before. I called my wife, and she recommended I see the doctor as soon as possible. They felt that it may be cancer in my bladder and referred me to a urology center in Colorado. They found a tumor, and I was diagnosed with NMIBC, the most common form of bladder cancer. Soon after the BCG treatment, they found that tumors had recurred. Being diagnosed with NMIBC was nothing compared to the devastation I felt when the doctors told me that I was no longer responding to BCG treatment. They presented me with the next best treatment, which was surgically removing my bladder. The thought of losing my bladder was terrifying, and I raised concern with the doctor. Fortunately, he offered me the opportunity to participate in a clinical trial using an experimental gene therapy treatment. All I had to do was visit the urologist's office once every 3 months for administration directly into my bladder. And because it's a gene therapy, I had no side effects. I continued to work with no impact on my day-to-day life. I completed the process, and the urologist told me that there were no more tumors. This gave my wife and me an enduring sense of hope, knowing that we could continue doing the things we love. Well, the experience may not be the same for everyone. This was mine, and I am forever grateful. The gene therapy I was treated with is now approved by the FDA and available to others. Finally, I'd like to echo Dr. KARSH's words that if you see any abnormal symptoms, seek medical care.
Well, I rejoice with you, Mike, too. I'm so glad that you're here to tell your story on the Valder Beebe Show, because we never know.
I'm with you all the way on that, yeah.
We never know who life you change when I talk to great souls like you. So thank you for sharing your story. I'm so appreciative.
Oh, thank you.
And his results are very gratifying, not only to him, but also to the doctors who treat these patients.
Yes, very much. Dr. KARSH, I'd like to ask you just one more question. What should the public know about treatments in the case when the cancer comes back? Like he said, just knowing that diagnosis of cancer is probably earth-shattering, but it's come back. I really can't ascertain that.
Yeah, well, if we know that about half the patients who are treated with the standard of care treatment like BCG will recur within 1 year. And up until now, the best treatment would have been to have your bladder taken out. But now we have a newer therapy that might delay the time until you would require a cystectomy or bladder removal, and maybe even avoid it altogether, like in Mike's case. But this is a treatment. This newer treatment is a gene therapy that is delivered into the bladder with a catheter every 3 months. So it has a very convenient dosing schedule, and it is given in the urologist's office where patients are comfortable and they have this familiar environment that they're used to. And so not only is it a convenient dosing, but it is a comfortable environment for the patients to be in. And it is also a targeted gene therapy, not a chemotherapy, so that it works in the bladder and works with the bladder cells and the immune cells in the bladder to fight the tumor directly in the bladder. So it doesn't affect the overall immunity of the patient. And this is why it's well tolerated. And it is a gene therapy that does not alter one's genes or their overall immune system.
Where can my audience go online and find more information about this?
If you go to adstiladrin.com, ADSTILADRIN.com, you can get more information about the indications for this. And if you or patients, people you know or relatives you know have BCG unresponsive, non-muscle invasive bladder cancer, speak with your doctor and see if this treatment is right for you.
Dr. KARSH and Mike, I feel so privileged to have the opportunity for you to facilitate your words to my audience. I want to thank you for being a guest on the Valder Beebe Show. I really appreciate it.
Thank you for having us.
Thank you very much.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBB Show and stay connected as I interview the world's most fascinating people.